students. I hope everyone is enjoying a good health. I am Asma Kamran and we are continuing our chapter circulation. Today's topics are hepatic portal system, renal circulation, blood pressure, baroreceptors, high pressure baroreceptors, low pressure baroreceptors or volume receptors, rate of flow of blood through arteries, arterioles, capillaries, venules and veins. And then cardiovascular disorders including atherosclerosis, angina pectoris, heart attack, heart failure, congenital heart problem. Now, first of all, what is hepatic portal system? Hepatic portal system is a part of venous circulation that drains the blood from gastrointestinal tract to the liver for processing and absorption of some transported material. Blood exits the liver then through hepatic vein, which merges with the inferior vena cava, which then open into heart. Hepatic portal system is required because the GI tract absorb digested nutrients, and these nutrients must be processed or they should be stored in the liver. As you can see in this figure, these are different organs of the digestive tract: stomach, spleen, pancreas, small intestine, large intestine. Veins from these organs fuse to form hepatic portal vein, which then open into liver, and blood from the liver then drains into vena cava through these hepatic veins. Now, what is portal system? Usually, arteries break up into arterioles, arterioles then break up into capillaries, capillaries fuse to form venules, and venules fuse to form veins. But in case of portal system, arteries break up into arteriole, arteriole break up into capillaries in some organ of the body. Then these capillaries fuse to form venules and vein. This vein, instead of merging with the larger vein, it again break up into capillaries in some other organ of the body, and then from that organ vein drains into a larger vein. This type of system, which starts as capillary and then again break up as capillary in some other organ of the body, this is called portal system. It is a part of venous blood circulation. Now, the hepatic portal system. As the name shows, hepatic portal system is the system which includes liver. Blood from different organs of the digestive tract drain into liver through hepatic portal vein. Hepatic portal vein is formed by the fusion of superior mesenteric vein, which emerges from the small intestine, and the splenic vein, which comes from spleen. But splenic vein also receives a vein from large intestine, that is inferior mesenteric vein, and a pancreatic vein from pancreas. And then the splenic vein and superior mesenteric vein fuse to form hepatic portal vein, which then enters into liver. But before entering into the liver, this hepatic portal vein also receives a vein from stomach, that is the gastric vein. Inside the liver, this hepatic portal vein breaks up into capillaries. These capillaries are called sinusoids. Blood flow into the sinusoids and then drain into central vein. Central vein then fuse to form hepatic vein. Hepatic vein, it also receives a vein from gallbladder, that is called cystic vein. This is a figure that shows different components of the liver, that is a transverse section. In transverse section, liver is made up of number of polygonal structures which are called lobules. This is a single lobule, and this is a magnified figure of lobule. Inside the lobule, you can see that these are the sinusoids. Blood from these sinusoids drain into this central vein, and this is a part of hepatic portal vein. And then this hepatic portal vein drains blood into this sinusoid, which is a dilated capillary, and from this capillary it then fused to form this central vein. Central vein then form hepatic vein, which then drains into inferior vena cava. Inferior vena cava then enters into heart. Now the renal circulation. As the name shows, renal circulation is a circulation in the kidney. Kidney is supplied with blood through renal artery. Renal artery enters the kidney through hilum, which is present in the concave part or side of the kidney. Inside the kidney, renal artery breaks up into branches. These branches are called interlobal arteries. These interlobal arteries run through the renal columns between the pyramids, and then this interlobal artery gives a branch that is called arcuate artery at the junction of cortex and medulla. Arcuate artery then gives number of fine branches which are called interlobular artery. Interlobular artery then gives an efferent arteriole. This efferent arteriole then makes a knot that is called glomerulus in the Bowman's capsule and leaves this glomerulus through efferent arteriole. Efferent arteriole then breaks up into capillaries and form peritubular capillaries and vasa recta that surrounds the nephron, which is the functional unit of kidney. Then from peritubular capillaries and vasa recta they fuse to form interlobular vein, and interlobular vein then form arcuate vein. Arcuate vein fuses to form interlobal vein, and interlobal vein then forms or it drains into renal vein. Renal vein then exit through hilum out of the kidney. This is another figure that shows different arteries and veins. You see renal artery enters through hilum into the kidney. It breaks up into branches. That branches are interlobal arteries. Interlobal arteries run through the renal column, that is the space between the two pyramids, and then interlobal artery breaks up into arcuate artery at the junction of cortex and medulla, and arcuate artery then give rise to interlobular artery. Interlobular artery then forms glomerulus through efferent arteriole and then leaves the glomerulus as efferent arteriole and then breaks up into peritubular capillaries and vasa recta and again form veins. As you can see in this figure, arteries and veins, they are running side by side, parallel to each other. So this is how blood is circulated in the kidney. Now the rate of blood flow in blood vessels. Blood flow means the quantity of blood that passes through a given point in the circulation in a given period. The amount of blood pumped by the heart in a unit period is called cardiac output. And the overall blood flows in the circulation of an adult at rest is about 5,000 ml per minute. Now the blood pressure. Blood pressure is a force exerted by the blood against any unit area on the inner walls of the blood vessels. And the standard reference for the blood pressure is the mercury manometer, which measures pressure in millimeters of mercury, that is mm of mercury. If the blood pressure is 100 mm of mercury, the pressure is not great enough to lift a column of mercury to 100 mm. And you already know that when the ventricles of the heart contract, the arterial pressure is highest and is called systolic pressure. And when the ventricles relax, the blood pressure is the lowest, called diastolic pressure. And this pressure is sensed by the receptors, which are called baroreceptors, and these baroreceptors are present in the blood vessels. These are also known as mechanoreceptors, and they are present in the wall of the aorta and carotid sinuses. Carotid sinuses are present in the carotid arteries. These are a swollen part of a carotid artery. Carotid artery is a branch which emerges from aorta, and it runs or It supplies blood to the head region. Now the baroreceptors, their function is to monitor blood pressure. As I told you, they are located in the carotid sinuses or in the sinuses of the carotid artery and in the aortic arch. Their function is to detect tension or stretch in the walls of these blood vessels. When the blood pressure decreases, the frequency of impulses produced by these receptors decreases, so result in the increased heart rate and vasoconstriction. There are two types of baroreceptors: high pressure baroreceptors and low pressure baroreceptors. High pressure baroreceptors are located at carotid sinuses, in the aortic arch, in the wall of left ventricle, and in another artery, that is right subclavian artery. Low pressure baroreceptors are present at right auricle, left auricle, and in the entrance of pulmonary trunk, pulmonary artery, and pulmonary vein. Now the baroreceptors, as you can see in this figure, this is the aorta which is emerging from the heart, and it forms this arch, and from this arch number of branches are formed, and this arch is called aortic arch. These white color points are showing the receptors, baroreceptors, and one of the branch which emerges from the aorta is carotid artery. This is a carotid artery which divides into two arteries, right external carotid artery and internal carotid artery, and you see that at the base where it is dividing, there are receptors. There is a swelling which is called carotid sinuses, and this sinuses consist of receptors for detecting the blood pressure. These are called baroreceptors. Now the high pressure arterial baroreceptors. As I told you, these are present in the walls of the aorta and carotid sinuses, and carotid sinuses are the points or a part of carotid arteries. They sense the blood pressure and then send this information to the brain so that proper blood pressure is maintained in the body. As you can see in this figure, this is a type of a negative feedback. Usually body should have a normal blood pressure, but whenever there is imbalance, the blood pressure increases or decreases, message is sent through these receptors to the brain. If the blood pressure increases, you can see that this blood pressure is sensed by the baroreceptors in the carotid sinuses and in the aortic arch, and message is sent to the brain where centers for controlling the blood pressure are present, and then through the parasympathetic nerve, blood message is sent to the heart for the heart decreasing the heart rate, and message is also sent to the blood vessels, so result in vasodilation. Vasodilation also results in the decrease in heart rate. So the cardiac output due to decrease in heart rate and due to vasodilation, the blood pressure decreases and comes to the normal range. Similarly, opposite occurs when the blood pressure decreases. A fall in blood pressure, it is transmitted by the same baroreceptors in the carotid sinuses and aortic arch to the brain, where centers for controlling the blood pressure are present. Through the sympathetic nerve, message is sent to the heart and to the blood vessels. Cardiac output would be increased, heart rate would increase, and the vessels, they would be constricted, there would be a vasoconstriction, so resulting in the increase in blood pressure that then brings the blood pressure in a normal range. This is the same figure that shows the baroreceptor reflex. This is that baroreceptors, they act as immediately to bring the blood pressure back to the normal if there is any imbalance, if the blood pressure increases or decreases. So this is called a baroreflex because it acts as a negative feedback system. Again, you can see that message is sent through the baroreceptors to the brain, and from brain message is sent to the heart and to the blood vessels, and then they constrict or dilate according to the change in the blood pressure, and then brings the blood pressure back to the normal. So this reflex is called baroreceptor reflex. Now the volume receptors or low pressure baroreceptors. These are present in the auricles of the heart and in the carotid arteries. When these receptors detect a change or a decrease in the blood volume in the atrium or in the auricle, a signal is transmitted from the receptors to the brain, to the part of a brain that is hypothalamus. Hypothalamus then stimulate a pituitary gland. Pituitary gland then start the secretion of vasopressin, which is also called antidiuretic hormone, and vasopressin act on kidney and result in the increase in glomerular filtrate along with the reabsorption of fluid, more reabsorption of fluid from the nephron, so resulting in arterial pressure. Vasopressin or antidiuretic hormone also results in the vasodilation, in the vasoconstriction or in the constriction of the blood vessel, so resulting in the increase in absorption of water from the kidneys. And that results in the retention of water in the urine, so result in increased blood pressure or increased arterial pressure. This is another figure. Message is sent to the brain, to the hypothalamus through the baroreceptors present in the auricles and in the artery, carotid artery, and hypothalamus then stimulate the pituitary gland then secrete ADH or vasopressin, which stimulate the kidney as well as the blood vessels. Blood vessels are constricted or vasoconstriction occur, and there is more reabsorption of water from the kidney, so resulting in increased blood volume as well as increased blood pressure. Blood volume is increased because more water is reabsorbed from the nephron, so resulting in water retention from the kidney, and blood pressure increases because of vasoconstriction. So both volume and vasoconstriction then helps in the increase in blood pressure. Now the comparison of the rate of blood flow through arteries, arterioles, capillaries, venules and veins. Blood travels over 1,000 times faster in the aorta, that is about 0.26 centimeter per second, and the total cross-sectional area of capillaries, it determines the flow of rate, because rate of flow of blood slows down in the capillaries because the cross-sectional area of capillary is more as compared to arteries, arterioles and aorta. So the total cross-sectional area of the capillary is much greater than in any other part of the blood vascular system. Blood slows as it enters the arterioles from arteries, and it further slows down as it enters in the capillary beds or inside the capillaries, and then again it speeds up when blood from the capillaries enter into venules and then veins, because when capillaries fuse to form venules and veins, the cross-sectional area is also decreased, so resulting in the increase in blood speed or rate of flow of blood. In this figure, you can see that this figure shows the total cross-sectional area of different vessels of the blood and the velocity of blood. You can see that aorta, its cross-sectional area is less as compared to arteries, and then arteries break up into arterioles, As arteries break up into arterioles, the total cross-sectional area increases. And arterioles, when break up into capillaries, which are the fine branching of the arterioles, so the total cross-sectional area further increases. As a result, as the cross-sectional area increases, the rate of flow of blood decreases. And when these capillaries fuse to form venules, again cross-sectional area decreases. It further decreases as venules fuse to form veins and veins fuse to form vena cava. So as the cross-sectional area decreases in venules and veins and vena cava, again the flow of blood increases as the cross-sectional area decreases. So in this figure you can see that the velocity of flow of blood is highest in the aorta, then it gradually decreases in arteries or slightly decrease in arteries, but much decrease in arterioles, and then it is slowest in the capillaries because the cross-sectional area of the capillary is largest and as compared to all the vessels of the blood vascular system. And then again the speed of or the velocity of blood increases as capillaries fuse to form venules, and then in the veins, and then in vena cava. This is another figure that shows the velocity as well as the total cross-sectional area. In this graph you can see that when the total cross-sectional area is less, the flow or velocity of blood is highest. As the cross-sectional area increases, the rate of flow of blood or velocity of blood decreases. So these two are almost opposite to each other. Now the cardiovascular disorders, these are the diseases of the heart and blood vessels, and cardiovascular disorders mostly cause deaths. First of all, thrombosis. Thrombosis is a formation of blood clot inside the blood vessel, so resulting in the blockage or in the narrowing of the blood vessel. And this formation of clot is called thrombus. Sometimes this blood clot may detach from the site of its formation and enter in the bloodstream. This is called embolism. And this detached blood clot is called embolus. This then through bloodstream enter in any other part of the body and might cause blockage of the blood vessel. This is another figure you see. This is a normal blood vessel, and this one is a blood vessel in which thrombosis or formation of a clot occur. If this thrombus detach from the site of its formation, then this is called embolism, and this detached mass is called embolus. About 99% emboli arise from the dislodgement or detachment of thrombi and are therefore called thromboemboli, and thrombus and embolus can cause death. This is another figure that shows embolism. You see a blood clot that travels within the body is called embolus. It may result in the blockage of any other artery in any other part of the body. Next is atherosclerosis. It is characterized due to the formation of yellow fatty streaks which are produced due to the high lipid content which are deposited in that part of the artery or in the intima of the arteries, resulting in the narrowing of the lumen of the vessel. And later on, fibers are also deposited in the cholesterol that is deposited in the lumen, and then it starts to calcify and become hard. So this is called arteriosclerosis. This results in the hardening of the wall of the blood vessel. And these deposits are called atheromatous plaque. And these plaques first form a thrombus and then they may form embolus. This is a figure that shows atherosclerosis. This is a normal blood vessel. But in this blood vessel, you see a blockage occurred due to the deposition of fats. Later on, calcium, cell debris, fibers, they start to deposit in it, resulting in the hardening of that plaque and in the hardening of the wall of the vessel that is called arteriosclerosis. Factors that cause atherosclerosis and arteriosclerosis are hypercholesterolemia, that is high level of cholesterol in the blood or high level of lipid in the blood, hypertension, high blood pressure, cigarette smoking, diabetes mellitus, increasing age, lack of exercise, stressful competitive life, obesity. And this is a figure that shows risk factors for atherosclerosis and prevention and treatment. Prevention is by avoiding the cigarette smoking through weight loss, exercise, and taking a proper diet. Next is angina. Angina is a type of temporary chest pain or pressure or discomfort in the chest. This is due to a narrow coronary artery and ischemia. Ischemia is that due to a plaque formation in the coronary artery, the blood flow to a particular part of the heart or tissues of the heart become insufficient, so resulting in a deficiency of oxygen or deficient oxygen supply to that part of the heart, so may result into heart attack. Angina is a signal that heart attack could occur in future. This is another figure that shows angina. That is a normal blood vessel, and this is a blood vessel which become narrow due to the plaque formation. So the blood vessel resulting in a deficient supply of blood and deficient supply of oxygen to that particular part of the heart, so resulting in the heart attack or maybe that into myocardial infarction. Now, what is heart attack? Heart attack occurs when the blood flow through one of the coronary arteries is totally stopped due to the blockage of coronary arteries, and the blockage is due to the plaque formation which is formed due to the deposits of fat. As a result, the coronary artery become narrow and may totally block the coronary artery, resulting in the stoppage of blood flow and oxygen to a particular part of the heart. As you can see in this figure, this purple part is showing the blockage of blood supply and oxygen to this part due to the blockage of coronary artery, and this blockage is due to the formation of a plaque in the coronary artery. This is another figure, an enlarged figure that shows the plaque formation in the coronary artery, and this blue area of the heart is damaged due to insufficient blood supply. Heart attack is also known as myocardial infarction. Myocardial means heart muscles. Infarction means death of these muscles due to the lack of oxygen. When the heart muscles die, they are not replaced because cardiac muscles do not divide. So a person that survives heart attack, at the site of the damage, a scar is formed or a scar tissue is formed, which is a type of connective tissue, and that grows into the area where the heart muscles have died. So this scar tissue cannot contract like the normal cardiac muscles because they are connective tissue, not muscles. So as a result, the damage to that particular part of the heart is permanent, that cannot be replaced or healed, and that results in the weakening of the heart. These are the warning signs of the heart attack: lightheadedness, dizziness, pain in the jaw and neck, pain in the upper back or shoulder, shortness of breath, chest pain or discomfort, nausea, sweats, fatigue. Another figure that shows different signs that are the warning signs of heart attack. Now, the heart failure. Heart failure is a condition in which the heart as a pump is unable to meet the metabolic requirements of the tissue for oxygen and substrates, despite the fact that venous blood which is returning to the heart is normal or it is increased. In simple words, this is a condition in which heart is not able to pump sufficient blood to the body according to the requirement of the body. This figure shows the heart failure. This is a normal heart with thick muscular ventricular walls, but in this case you can see that as heart have to pump more blood to meet the requirements of the body, the muscles of the ventricle, they become weak and resulting in the enlargement of the heart, and that leads to heart failure. Now the last one is congenital heart problem. Congenital heart problem means the problems of the heart which are present at the time of birth, and these, in most of the cases, these are related due to the malfunctioning of cardiac valves. The most common is valvular heart diseases. These valvular heart diseases, as the name shows, due to a malfunctioning of the cardiovascular valves or the valves present in the heart. The valves that are present in the heart are bicuspid, tricuspid, valves present in the pulmonary aorta, that is pulmonary valve, and valve present at the base of aorta, that is aortic valve. The valves may fail to open properly or they may fail to close properly. This is a figure that shows valvular stenosis. As you can see that this is a valve that is present at the base of the aorta. This is a normal aortic valve in open condition that open properly to allow the blood to flow from ventricle into the aorta, and this is in a closed condition, so it closed properly to prevent the backward flow of blood. But in valvular stenosis and regurgitation, what happens? The valve fail to open properly, so result in insufficient blood movement from ventricles to the aorta. And in the other condition, valve fails to close properly, so result in the flowing of blood back to the ventricle from aorta. This is called regurgitation. And the valves, they become hard or stiff or they fail to open and close properly, may be due to hardening and thickening of the chordae tendineae that regulate the opening and closing of valves. This is another figure that shows the mitral valve stenosis, and this one is mitral valve regurgitation. Stenosis is that when the valve fails to open properly. So you can see that due to which the blood is not properly or sufficiently pumped to different parts of the body. But in regurgitation, the valve fails to close properly, so resulting in the flowing back of blood in the chamber.
What is valvular heart disease? The heart's 4 valves play a very important role in ensuring blood flows in the correct direction to the heart. The valves are the tricuspid valve, the pulmonary valve, the mitral valve, and the aortic valve. Valves at the entrance to the large chambers of the heart, the tricuspid and mitral valves, ensure that blood can flow only into the ventricles. The pulmonary and aortic valves allow blood to flow out of the ventricles and into the pulmonary artery and aorta. In patients with valvular heart disease, the damaged valve or valves affect the flow of blood. This can be in 2 ways. If a valve fails to close properly, it will allow blood to leak backwards. This is called valve regurgitation. For example, if the mitral valve leaks as the left ventricle contracts, instead of all the blood leaving the heart through the aortic valve, some will leak back into the left atrium. If this is severe enough, it can put a back pressure on the lungs. If a valve fails to open properly, it obstructs the flow of blood. This is called valve stenosis. For example, if the aortic valve becomes stenosed, the heart will need to pump harder to force the blood past the valve. This can cause the heart muscle to become thickened. Any of the valves can become regurgitant or stenosed, and both can put an additional strain on the heart. Although many patients have few or no symptoms, some patients develop breathlessness, chest pains, tiredness, dizziness, swelling of the legs. The symptoms of valvular heart disease will vary depending on which valve is affected. Even after a valve problem has been diagnosed, patients may go many years without developing any symptoms.
This is all about for today's lecture. I hope everything is clear to everyone. Thank you very much.